Hi, and welcome to VisibilOT, a podcast dedicated to raising awareness, providing education, and advocating for individuals living with invisible disabilities and chronic conditions. I'm your host, Lisa, and I'm passionate about providing education for individuals and healthcare providers alike to bring visibility to an often misunderstood population. Today, we have Cheryl Faber and June Bryant on the show. I am so excited to have them both here. We're going to be talking about a very interesting topic today, dysautonomia. So if you are someone who is impacted by dysautonomia, you know someone who is, or if you're thinking, what is dysautonomia? I've never heard of that. What the heck does that mean? You are in the right place. So Cheryl is the Director of Education for the Dysautonomia Project. It's a nonprofit organization with a mission to educate healthcare professionals, patients, and communities about dysautonomia. And June Bryant, Dr. June Bryant, is a doctoral-prepared nurse practitioner. She's an assistant professor of nursing at the University of Tampa and is also the medical ambassador for the Dysautonomia, or a medical ambassador for the Dysautonomia Project. So I would love it if you two could just tell us a little bit more about yourself.
Great. Thank you, Lisa, for having us. I'm Cheryl Faber. I've been with TDP for 10 years now, and I'm the Director of Education. And my passion is the mission of our organization. Our founder, as we'll talk about in a few minutes, has dysautonomia. And as I learned more about it over the years, I realized how many people are impacted and how many are not able to get the care they need. So I'm extremely passionate about spreading awareness of this condition and using my long background in education to promote, awareness about what we're doing. And the exciting thing is we're all about education. So perfect for us to be on your show. And thank you for inviting us.
Of course, yes. Thank you for being here.
You're welcome.
Yeah, so thank you so much for having us. So excited to be here and continuing to spread information about this condition. I'm June Bryant, so Dr. June Bryant. I am an assistant professor at University of Tampa, but I also have my own mobile primary care practice in the community. And I'm the president of our local pediatric nurse practitioner chapter as well. And so those are some of my roles, but this is absolutely one of my passions. I love having a role in TDP, and because I had an instance when I was a newer nurse practitioner, and I had a patient that I just had no idea how to diagnose or what to do. And I realized that the education, even from a nurse practitioner, or even what we're finding medical school standpoint, they don't go into depth a lot of times into these disorders. So being able to spread even after the fact information and how to treat our patients and really give them hope is just one of my dedications and my passions right now. Wow, amazing. Yes, you both are so wonderful. For people that maybe don't know, I know a lot of listeners kind of live in this world where dysautonomia is very prevalent, but for those who don't know, could you explain what exactly is dysautonomia for those who might not have heard of it?
Sure. So dysautonomia is an umbrella term for disorders of the autonomic nervous system. So it's not a diagnosis in and of itself, but rather that umbrella term. And there's multiple forms of dysautonomia, different types of dysautonomias. So the autonomic nervous system is responsible for those things that our body does automatically, like digestion, perspiration, or heart beating, or blood pressure. And if something is awry in the autonomic nervous system, there will be a disorder or dysfunction that occurs that can impact, multiple organ systems. So dysautonomia is it's really broad, but it encompasses anything that could go wrong with the autonomic nervous system. Anything else, June, you'd want to add to that?
No, I think you did a great job talking about that. Um, I think what makes it so invisible is that, it's not necessarily something it's not an easy thing to diagnose, just because it comes in multiple forms. And it's different and it's individualized for every patient. So there's no black and white for this condition. So, no, I think Cheryl, I think you did a great job.
Thank you. And you made a good point. There's not a black and white. It can look so different for so many people, and it crosses so many different organ systems that unless you are educated about it or trained in it, it's easy to miss or pass off as anxiety or, mental health condition, something like that.
Wow. Yeah, I love that you talked about kind of the multi-systemic impact because that is so true. And then even under kind of the umbrella with individual diagnoses, I mean, one person can have a specific diagnosis that can impact a lot of their body systems completely different from how it impacts somebody else. So, yeah, thank you for talking about that. And then a little bit more about the Dysautonomia Project. So, can you share the story behind it, kind of its founding, and then the goals of the organization?
Sure. The organization was founded in 2014, so we're entering our 11th year. But prior to 2014, Kelly Freeman, she and her husband Nate and her mother Karen are the three people who founded our organization. And that was because several years prior to 2014, Kelly went from being a very energetic, dynamic, busy, involved mother, business owner, volunteer, community member, to having a dental procedure that changed her life, really. She ended up bedridden for several years and had lots of different symptoms that she didn't understand, and the local medical community was not able to give her answers. So she went on her own journey to figure out what was wrong and ended up meeting a physician in North Tampa who understood dysautonomia and gave her a term for what she was experiencing. And as a result of that meeting, Kelly and her husband Nate and her mom Karen said, it's not okay for other people not to know about this. We were educated, and that education made a huge difference. So let's do something with that so that other people can be educated as well, whether they're patients, caregivers, providers. So they founded the Dysautonomia Project. We're a 501c3 nonprofit. We're based here in Clearwater, Florida. And in addition to that, Kelly started writing a book. And that's the one that is available now. And yes, that one right there is very popular. So she had some other physicians co-author the book with her. It's become one of the top sellers on Amazon. And we're excited to share that she's in the process of writing a second edition that's going to come out later this year. But it's been a foundational tool for our education. And because Nate and Kelly realized that education was so lacking, they wanted to make that the principal mission of the Dysautonomia Project, and it still is today. So that's our singular focus, is educating about autonomic nervous system disorders and educating patients and community members and healthcare providers across the board. So it's amazing to see the changes since we were a grassroots organization that started in 2014 to now being the global leader in dysautonomia education, and the relationships we've built with wonderful providers like June and others who come alongside us to champion this cause.
Wow, that's amazing. Yes, and for those of you who are not familiar with this book, it is awesome. And what I really like about it the most is that it's kind of split up. We'll probably talk a little bit more about it as we go on, but I'll show it for the people that are watching visually. But for those of you who are just listening, one side is for patients and the other side says for physicians. And it's kind of explained in both layman's terms that are easy to understand and then also with all the fun medical jargon. So it's really interesting for me, both as someone who is kind of in the healthcare world, but also kind of a patient myself. I loved reading both sides. The education is so important, and this is not about me, but I'll just tell you from my personal experience as someone who was having all of these obscure symptoms, went from, super energetic and everything's good and working out. I was training for CrossFit competitions to all of a sudden just all these weird things going on with my body. I remember the day that I did my first just kind of preliminary the at-home, the NASA lean test with, monitoring my blood pressure and heart rate from lying down to standing up and just seeing the numbers on paper and going like, wow, I had no idea that was happening in my body. I knew that every time I stood up, I would get really dizzy and feel kind of nauseous or just not feel well. But I had no idea that my heart rate was spiking, going crazy, and just kind of having that, not diagnosis yet technically in that sense, but just seeing numbers that made me go, oh, it's not all in my head. I'm not crazy. Like there's a physiological thing happening that is causing me to feel this way. I cried. I called my mom. I said, I know what's going on, or I have an idea, or there's proof in a sense, that I'm not crazy. And I remember it just being such a exciting feeling to at least just have some information and be able to go on websites like yours and others and just learn and educate myself. So I didn't feel so lost and just powerless, I guess. So you're doing amazing things. I know if it's helped me, it's probably helped thousands and thousands. So in that sense, are there any misconceptions about dysautonomia that you hear from patients or healthcare providers, and how should people navigate those?
Yeah, so absolutely. One of the biggest misconceptions, especially amongst healthcare providers, is that dysautonomia is rare. It's just really it's not, it's really just underdiagnosed or misdiagnosed. And they also think that the symptoms that these patients experience are just purely psychological, especially in our younger patients, especially in our teenagers. And it leads to delayed or inadequate care. One other misconception is that they think that dysautonomia is just low blood pressure or one specific symptom. And they don't really understand that it really is a complex autonomic nervous system disorder. And I think that comes from that lack of education, right? For patients, one of the biggest misconceptions that I know is that we'll do all of this blood work, we'll do all of these tests, and everything comes back normal. So then they feel hopeless and they feel like why is nothing coming back positive, right? Why does this mean I don't have anything? And I know what I feel, but why is nothing saying that something is wrong with me, right? And they feel like there's nothing that's ever going to be able to help them to get out of what they're feeling. And so a big thing to understand is that dysautonomia is a functional disorder, and it does require very specialized testing and a multidisciplinary approach to treatment. Like I said before, it's not black and white. Every patient is going to have to be diagnosed and treated individually. So they need their own special individualized care when it comes to dysautonomia.
Yeah, those are huge. Cheryl, did you have anything you wanted to add to that?
I just agree with everything that June has said. All of those misconceptions, we hear from patients frequently who reach out to us just so desperate for some help, and they are not sure exactly what the Dysautonomia Project does. They may not realize our mission is education and instead think we're a support group or even a physician's office, but they're just looking for someone to listen to them, to believe them, a provider who has this on their radar and their differential to be able to get some answers. So yeah, well said, June.
Very well said. Yeah, and on that note, finding a provider, especially, an informed provider about this is really difficult. Do you have advice for maybe those people that suspect they might have something going on and is seeking that kind of care?
Yes. So one of the greatest tools known to mankind is on the Dysautonomia Project's website.
Ever of all.
It's called an assessment tool.
Yes.
So if you have a patient who is kind of on edge and they're like, I think I may have this, or maybe someone has mentioned that it is possibly that, they have a great tool that can help validate and give them some kind of hope until they can get to an informed provider. Some things that I really recommend to the patients when they're trying to find a provider is really having a log of their symptoms, because that's really helpful. And there's a lot of symptoms, like a lot of symptoms, right? It affects multiple body systems. And they said on average, about 33% have 27 different symptoms, right? And that's really helpful for us to know going in, because there's a lot of questions that us as providers have to ask. And it can be very time consuming. And I don't say that with any disrespect. I'm saying that we want to spend a lot of time with our patients and we want to make the most of that time. So that's one thing that is really helpful that patients need to know when they're going out on their search. Now, I think that it's also important that when our patients are calling to ask certain providers, not all providers do know about dysautonomia and the symptoms and specifics or testing. Ask when they're calling a potential provider, ask if they have any knowledge about POTS, about autonomic dysfunction, if they have current patients that they see and they manage with those conditions. I think that that's super helpful. Another thing is I really want them not to feel dismissed if they feel like a provider isn't listening to their concerns. Just remember, it's most likely lack of education on their part, but don't be afraid to call someone else who may and get a second opinion on someone who may be more knowledgeable on the topic. I know it's hard to feel hopeless, but there are people out there who are knowledgeable and will fight and advocate for you and get you what you need to be able to function. And then also, sorry, just one more thing. If just realize that it's not a simple disorder, which means that it's going to be multidisciplinary. And I said this before, but there's not very many autonomic function clinics that have all different specialists or someone who can handle all the symptoms that come along with dysautonomia or autonomic dysfunction. So there might be a team of people that are on your side: neurologists, cardiologists, gastroenterologists, occupational therapists, physical therapists, dietitians. Sometimes you need a whole slew of people with different knowledge to help your symptoms. And that's very overwhelming for the patient, but sometimes it's really necessary, depending on where you are. Ideally, we would have all of these autonomic centers where all of these readily accessible, not having to book 6 months out, right? But we don't. So if you're feeling like you're being referred to multiple places, it's just because they're trying to get the best management for your specific symptoms.
Yeah.
Okay, I'm done.
No, those are great points. And I like that you brought up the advocacy part of it and not giving up, because you're right. So many providers may not know about dysautonomias. So being armed with the answers to the questions from the patient assessment tool, so you have everything collected in one spot, And don't give up. Just keep calling and looking for different providers. Maybe have a trusted friend or a caregiver who can advocate with you on the days that you're not feeling well. And go to the Dysautonomia Project website, because we have a provider finder on there, and you can put in your zip code. You can look throughout the United States. There's even some providers shown in other countries, and find somebody who is familiar with dysautonomia. We are constantly looking to build that, because we know that there are not enough providers who understand what this is to be able to help. So if you or any of your listeners have someone that you're seeing, whether they're primary care, family medicine, or a specialist, and you've gotten good care from them and they understand what this is all about, have them reach out to us so that we can add them to our list. There are some states that have multiple providers. There's other states that have zero, and people are having to travel. So we would love input, if you and your listeners know of someone we can add to that. But that's a good place to start.
Yeah, absolutely. I went on that tool and it's very user friendly. You can, you can change it based on radius, on how far you want to travel. And it's great. And it's so nice to kind of be able to open that and see all the little dots on the map and go, oh, there are people that, care about this. And that's great. So kind of in that sense, what has been the response that you've seen from the broader medical community to the work that you're doing? Like, have you seen a shift in awareness, that people are kind of being receptive to the education that you're putting out?
Yes, definitely. I think, in our local community, especially, the average time to diagnosis when TDP started 10 years ago was around 6 years. And in the Tampa Bay area, we're down to several months because of that education. So that's huge. And, it's exciting to see the collaborative relationships that we've developed with providers throughout the area. Ones like June and many others who have come alongside us, and they take part in our education. They connect us to others within the medical community. So we are asked to come in and speak, whether it's grand rounds at a hospital or to school systems or at universities, or virtual presentations. The word is getting out there, and I do think that providers are receptive. And nationally, it's exciting because we've got a strong relationship with the American Autonomic Society and have developed programs that can have an impact on a national level. So I think there's become, more engagement and involvement and more people listening. What would you say, June, from your perspective?
Oh, I agree 100%. The number of hands that go up in the beginning of any presentation, we're like, okay, who is familiar with, autonomic dysfunction or dysautonomia? And then I'll say, okay, what about POTS? And, a whole slew of hands go up, and it's just wonderful, and it really does warm my heart. So we speak at national conferences, and the response to those are really wonderful too, because a lot of times TDP will actually have exhibit booths and be able to give books out and more information. And just the response to the sessions, that when I speak on the topic, they come by and they're like, this was so helpful. I have patients with this, or my mom or my sister or my kids, or and making connections that way has been huge for us. And I'm thrilled that the mission of this organization has come so far, and that we're still seeing the need. We still see deficits. We still see lack of providers that are aware. So until every provider out there is aware, we have work to do.
Yeah, and you've made a good point, and it's true. Like, I think back to the presentations years ago where maybe no hand or one hand would go up, and now over the years there's so many more, especially since COVID. Like, in your experience, it brought it to the forefront, and so there's so many more people that know about it or when we go to the conferences and June speaks, so many people are driven to our booth and say, I have someone in my personal life, or I'm treating a patient, or I just saw this person. This is so timely that you're here. Can I have a stack of books to help educate? So we're doing that, and they're continuing to educate more and more.
Wow. Yeah,
Yeah.
that's great. Even I'm here in Tennessee, and I did a little presentation at the Tennessee State OT conference a few months ago about long COVID and kind of related conditions, what we can do, how to kind of spot it. And the number of people that went, wow, all these dots are connecting. I've had people with these
Yes.
obscure symptoms and no idea kind of what was going on. And I think this might be happening. I said, yeah, I think a lot more prevalent than people realize, like you said in the misconceptions, that it's a rare thing, but
Right.
really it's not. I know we talked a little bit about this book, but as far as education, what other cool things do you have going on? I know I've been seeing a lot about some the residents, what is it, the
Residence course.
clinician program
Yes.
stuff. Yeah. Tell us a
Yeah.
little bit about those.
So those are super exciting. We just finished both of those last month. They are some of my very favorite programs that we do. The residence course was started several years ago as a way to reach young doctors who are not getting the education in medical school and want to learn more about it. So we had a class of 40 this year. We expanded it from 36 to 40 because we have so many people that are applying and being nominated by program directors throughout the country and have long waiting lists. So we had 40 physicians come in to Clearwater. They were trained by the top autonomic specialists in the world over 3.5 days. They then take that knowledge and they go back into their resident communities and they present. So we're exponentially, increasing the number of people who've been trained. That's a lot of fun. We start that process again this summer in preparation for our 4th year doing it next January. And we also started the clinician program for the first time last month. Dr. Bryant was a part of that. And that was a way to take this same amazing group of faculty that we already have on site for the residence course and run a concurrent one-day program for practicing clinicians. So we had physicians and nurse practitioners, physical therapists, psychologists, just anybody who's practicing who wanted to learn more about autonomic medicine and how to diagnose it, how to treat it, manage care. So that's the first, and we're going to continue to do that. We also have in the summer a program for patients and caregivers. That's called Discourse, and that's a virtual event. And I would highly encourage your listeners to register for that. Registration is not up yet, but watch us on social media and our website. You'll see it coming soon. But that's an afternoon program on Friday, June 6th. There will be topics that are, relevant to so many different areas of life for a patient and caregiver. And again, they're taught by experts in their field on whatever topics are chosen. So we do that education for patients, for residents, for clinicians. And then we do a lot of one-on-one customized training where someone will reach out to us and say, I've got a group of clinicians in this specialty, or we'd like to learn more about this, or, school nurses want to learn more about this. And so we'll take that information and develop a program. And as June said, we also do a lot of national conferences where we'll have a strong presence at especially nurse practitioner groups. And she'll speak on a topic. We'll have a booth, hand out our books. We're open to anything and everything for education. The other thing is our website is extremely robust with education. There's a lot of videos that we've done in collaboration with the American Autonomic Society that are a great learning tool. We've got the patient assessment tool that June mentioned, which is it's the first of its kind, the only one of its kind, and is really helpful So check it out if you haven't.
Wow. Yeah, that's
Yeah.
amazing. I just love this education focus. I know I've said this so many times, but it's just it's one thing to, be a provider yourself who's able to provide this specific type of care, but to be able to educate other people as well, like you said about kind of that exponential increase. Like,
Mm-hmm.
I, for example, am just me, and I'm just here in Nashville, Tennessee. But, if you are able to educate other people and get more and more providers nationwide involved, all of a sudden the amount of people that can be reached is just going up and up and
Yeah.
up. And that's so important.
Yeah.
I love what you're doing. I know, June, you had talked a little bit about earlier. Oh, also, I meant to say, your clinician program looked amazing. I wanted to go so bad, but I ended up having something come up, and I had major, what the kids are calling these days, FOMO, the fear of missing out. It was so sad that I had to miss it, but it looked incredible, and I think that's an awesome, awesome thing that you're doing. You had mentioned a little bit earlier about kind of all the different providers that you might have on your team. So as far as, other healthcare professionals, allied healthcare professionals, OTs, PTs, what would you have to say about to those people if they want to better learn about dysautonomia or support patients that are experiencing dysautonomia? How can they find that education?
Awesome. Well, the clinicians program is a really great place to start. It was fantastic. And I'm not just saying that because I was a speaker there. We had such good feedback.
Mm-hmm.
And I highly, highly recommend anyone, any healthcare professional, no matter what discipline you work in, it's a fantastic way to get a good background and know what you can do to support your patients in any capacity, whichever capacity you're supporting them in. But it's also helpful because you find out what the other roles are and who you can refer to for things that maybe are outside of your scope or outside of your control, and knowing what services they can provide too. I think the biggest thing, again, is education, right? You're seeing these patients, and it's hard because just like you said, Lisa, when you aren't aware of what the condition is and they just come in with something like failure to thrive, or they have hypomobility or whatever the diagnosis that they come in that's not specifically autonomic dysfunction. Sometimes they come in and they have all these other symptoms, and you're like, I don't really know what to do with all of those. That's not really your occupational therapy. But being able to recognize that it could possibly be this and knowing who else to tell them, say you can really get help. So I know someone who can really help you with this aspect of this disorder. It's just so helpful for your patients, right? So things that are very specific, of course, education is important for every allied healthcare professional. Knowing that there's such a big physical component to a lot of these disorders, just know that knowing to advocate, make sure that they're moving somehow. As an occupational therapist, that's great. Physical therapy is great. Just a graduated exercise program. I think that's what a lot of the studies now were showing, that any increase in physical activity is definitely helpful for these patients with these conditions.
Mm-hmm.
I think that one of the biggest things in any capacity for anyone who's caring for these patients is just to be an advocate. They need that. They need the support. We're so used to working in such a high-paced capacity, and we're so quick, but these patients need time, and give them that time, and it will bring them hope. I feel like they just don't get that enough. And so that's just what my recommendations are for anyone that works with our autonomic patients.
Right. Yeah,
Mm-hmm.
that's so important. And I guess it can seem kind of daunting. I think maybe a huge barrier for a lot of healthcare professionals is like, oh my goodness, this is this big umbrella term, and there's so many different diagnoses under it. And how am I ever gonna, between work and documentation and family find the time to learn everything about all these different things. But even just having that kind of baseline understanding, you're not going to go to the clinician program probably and come out knowing everything about everything, but just
Right.
having, that desire to learn, but also just getting that foundational knowledge about what's going on, what's happening in the body, and being able to kind of, I guess, wrap your brain around it. You don't have to come out being an expert, just being willing to listen and continuing to learn and seeking out that education is huge. I remember, of course, you come out of school and I'm like, oh, how can I ever see clients? I need to know everything about everything. And oh my goodness, but you don't really. You're continuing to learn as
Right.
you go throughout your professional career. And I think that's really important.
Absolutely. And, it's, I think for a lot of patients, it's just having somebody say to them, I believe you, and we're in this together. And I don't have all the answers, but we're going to find it out. We're going to research this. I'm willing to learn. I'm willing to help you. That right there is just so important. And most people aren't going to become experts in autonomic medicine. It's a very complex system with a lot of complex disorders. There are just, 60 or so autonomic specialists with certifications in the entire world. So it is a small, narrow field, but there is so much that a general provider or an allied health provider can do. And like you said, just having that baseline knowledge or having this on your radar enough to connect the dots, like you were saying, when you begin to hear things, just knowing that dysautonomias in general will have symptoms in multiple organ systems and abnormal orthostatic vital signs. And if you're seeing those two things together, start thinking, oh, this could be this, and then reach out to the Dysautonomia Project, to the provider finder to find others who know more about it, or, we can help. If you can't find somebody, that's what it's all about.
Yeah, and I love what you said about listening and validating. I think it's so easy sometimes to, I think June, you talked about a little bit earlier about, running all the blood work and all the tests. And, I think sometimes as a provider, you get excited, like, oh, look, there's nothing wrong on paper. Because obviously nobody wants their patients to be sick or have something wrong,
Mhm.
And I've talked to a lot of people about this, and I have heard so many of them that have had this experience of, yeah, my doctor came back and just all happy, like, congratulations, all your blood work is negative, all these tests have been negative, like, you're healthy, and just that crushing feeling inside of like, but I still feel so bad, like,
Yeah, like I
and
know something is wrong. Mhm.
right, because, people know their bodies. They can tell when something's off, and not being heard can kind of start that spiral of like,
Right.
is this in my head? Am I exaggerating? Is it no? And another thing I've heard a lot from people is feeling like their symptoms maybe aren't bad enough to seek out care because
Mm,
some of these symptoms can be obscure, and it's like, oh, I feel off. I'm not where I'm at baseline, but I'm still having significant functional impacts. What would you say to those people that maybe aren't sure if what they're feeling is, I don't know, warrants seeking
mm,
care?
Right. And it's so tough because a lot of the symptoms that the patients have with dysautonomia are subjective. So, sometimes it is a headache or sometimes it is just dizziness, right? And the thing that's difficult is that everybody, usually at one point or another, has some of these symptoms, right? I mean, I have a headache, maybe every other day, or, sometimes I feel dizzy. So then it's really easy for those that aren't aware of all of the symptoms altogether it's really easy for us to dismiss them. Because we're like,
Mhm.
oh, I had a headache yesterday, right? Or I had this, I felt a little dizzy, or I'm really tired too after a long day. So why is what they have different, right?
Right.
But it's really the constellation of all of the symptoms together and that feeling of just not feeling well. And for anyone that are feeling those that are unsure, that's why we have that patient assessment tool. That's why it's important to find a provider that you could even just trust and say, I'm having these symptoms that are just off the wall, and I don't really understand why I'm feeling this way. Because, a patient knows their baseline like no one
Yeah.
else, right? I mean, we know when we are feeling off because we have felt okay before, right? We felt okay. So we know if we're not functioning at that same capacity, something is
Right.
off. So knowing that it is a multi-system disorder, knowing that everyone is going to have different severities of this, knowing that everyone's going to have different symptoms that come from different body systems. I mean, symptoms that come from different body systems. I think that that's just very important to recognize, and um, don't hold back if you feel like if you're off, right? There is somebody out there that is going to believe you about your symptoms. They will know what to do. Just don't give up hope. And that's where we see the whole psychological impact come in, which is it's so hard because it's a circle, right? You get stressed out, you feel hopeless, and then your symptoms, you get an exacerbation of your symptoms because stress can definitely cause it. It's not what the condition is, but it can make it worse. So, finding someone who you can talk to and log and help you log your symptoms, and I really feel like that's very important.
Yeah, that's great. And this part, so you obviously see a lot of dysautonomia patients. What, I don't know how to word this question per se. As far as who is impacted by this, and I think I know what you're going to say, but I mean, is it a specific age? Is it a specific, type of person with a certain activity level, or is it kind of a broad thing?
Well, I can talk from my point of view. So my specialty is pediatrics. So I focus solely on, under 21. And our biggest diagnosis that falls under the umbrella is POTS, is the postural orthostatic tachycardia syndrome. And that usually starts around puberty age. And so the issue is that because it's so misdiagnosed or underdiagnosed, a lot of these patients will have these symptoms for years before they even seek care because everyone's saying, oh, well, that's just part of your hormones. That's just you getting older. Those are all normal, right? So, but we know that that's not the case. That's definitely not the case. So that's what I see a lot of, especially with POTS. It's going to be those high academic achievers and high athletic achievers. And sometimes, a lot of times, both, right? Their stress levels are higher because they want to maintain themselves, but that's who we usually see these conditions affect the most. So I see a lot of it in my college students, a lot, because that's where they are. And they're like, oh, I'm so tired. It's like, oh, well, you're doing too much. Like, you're doing all of this stuff, and it's not the normal level of fatigue, or it's not the normal level of GI distress or that you would expect comes along with stress. So I hope that answered your question.
Yeah. And primarily female in POTS. There are males that have it, but it tends to be a predominantly female condition.
Wow. Yeah. And that is so interesting. And I love that you have this kind of peds background, because what I hear people say all the time, they told me I'm too young to have that. Or like, oh, look, you're a young, healthy athlete. Like, good. No, you're good. Like, but it's true. It really impacts people of all ages. And especially, yes, when you do have these hormonal changes going on, and maybe you're doing your college applications or this or that. It's so easy for people to go, it's just stress,
Yeah.
you're stressed out. college is hard. Everyone gets stressed. Everyone gets tired. But there is the difference. I remember being, in college, I worked a bunch of jobs and I played college volleyball and I would do school and go to volleyball practice and go to work and go to other work. And I remember, a doctor telling me once, "Oh, you're just exhausted because grad school's grad school." And I went, "Yeah, but like I've been overloaded before. Like I've had a lot of things on my plate." And I said, like, this fatigue is unlike anything I have ever experienced. And they're like, "Blair, just see how you feel after grad school or when things calm down."
Mhm.
And that kind of, those kind of statements just really hurt to hear sometimes. It's hard to, see providers that aren't giving you that validation or hearing you or listening to you. So I really appreciate you bringing all that up. It's
Mm.
really good to kind of hear from the pediatric side because I don't think a lot of people realize that there's no correct age to be affected by something. It can affect anybody.
Right. And Kelly, when she was first diagnosed, I believe she was in her 40s, and that was a sudden onset from a medical procedure. So, um, it can happen through, at the time of puberty, or it could happen through a sudden onset. It could happen through a concussion, or other trauma. It could happen through an infection, a viral infection like COVID, or Epstein-Barr. There's just lots of triggers for it. POTS in particular is generally in that pediatric to maybe age 50 or so age range. And then in early pediatric years and in the geriatric years, there are other forms that would pop up. But yeah, it is interesting how many POTS cases are coming up in those younger years or being recognized in those younger years.
Wow, yeah, and thank you for touching on that because I feel like that's such a big point that we haven't even discussed is this is something that can kind of come on at any time. So, is this her all dysautonomia conditions something that you're born with, or no, they can be triggered by something at any time throughout any stage of life. And a lot of people, I don't think, understand that either. It's like, what do you mean I just developed this condition out of nowhere? Like,
Mhm.
how does that even happen? So, wow, yeah, that's so interesting. Are there any other, big points or topics you would like to hit? This is your episode. This is your floor.
If you're interested in learning more or getting involved with TDP, I just wanted to point out on our website, there are ways that you can do that so you can stay connected. On our homepage down at the very bottom, you can click on the Join the Community button, give some contact information, and that way you're on an email list, to become aware of newsletters and announcements and things that are happening. There's ways to volunteer or to make donations, to get books. If you want to get books, there's book promotions throughout the year so that you can send one to your healthcare provider, or get a second one free. You can sign up for Discourse, and that's going to be, a free program for patients and caregivers this year. We've had a sponsor come in and underwrite the registration fees. So, follow us on social media, watch for those posts to come out and sign up for that. That's going to be really important. So stay connected with us. We're a great resource for you.
That is so exciting. Yeah, not only, it's one thing to say we want to educate people, but the way that you put out education, and I love this push to make it accessible for people. That's so exciting that
Mhm.
Discourse is going to be free. What an amazing, amazing resource. How exciting. And yes, for anybody listening, I will link all of the things in the show notes so you can just click and show up. Wow. That is so, so great. So on social media, I know you're on Instagram. Are there any other platforms that are good to follow?
Yep. Instagram, Facebook, Twitter. I think they're even working on LinkedIn as well.
Oh,
Yeah. So,
how exciting.
yes.
I haven't quite figured out LinkedIn yet. No, I'm working on it, but
Yeah.
wow.
Well, follow those and, and share the posts. Let more people know about the things that we're doing and the educational posts that we have so that other people can be educated. It's all about, just continuing to share the information, spread the word.
Yeah, spreading the wealth of knowledge. We
Exactly.
love that. And for anybody, I mean, I would really like to kind of emphasize, I think everybody could benefit from this knowledge. I mean, if you were just, a human, maybe you don't even know anybody that's impacted by this yet, but just having this knowledge so that if you do have a friend or family member or even yourself, and, this kind of pops up, to be able to be a person that can say, oh, yeah, no, I understand, that can validate them. Any sort of healthcare provider, if maybe you're a nutritionist or an OT that thinks, well, gosh, I haven't seen any patients with this yet, or this isn't big where I am, it doesn't really affect me. It's still just such good information to have, to be able to notice and spread this information. So I really appreciate that you are just this amazing resource. I don't want to sound like I'm just, the pet ever, but I mean, really, the resources you put out are amazing. And like you said, your website is phenomenal. Just the amount of information that you can access on there for free is incredible, because healthcare challenges can be expensive. So access to education is amazing. Do you have any other closing thoughts about anything?
June?
I'm so happy that you reached out to us to be able to provide information. I think that even if it's not something that impacts you individually, to your listeners, wherever you're coming from or whatever population you are, I think it's knowing where to find the resources when you need it is also important. So listening and understanding and knowing that the person next to you may look amazing and beautiful and look like they feel fine, that they could really not be feeling okay inside. I really think that that's important too. So just be kind and listen and be supportive to those around you, because you never know what they're going through.
Yes,
that is such
well
a good
said.
closing thought. Yeah, not even just for this, but just for life. Like,
Yes,
be kind to people and supportive and understanding and listen. Yes, that should just be on a t-shirt. Little reminders to everybody all the time. Well, I am just so thankful that you both came on today. This is amazing. Just as a little reminder to our listeners, everything that you hear in today's episode should not be considered medical or therapeutic advice, and to please consult with a qualified medical or healthcare professional for personal medical concerns. I will link everything below so that you can stay connected with our friends here from the Dysautonomia Project. And I hope that this information was helpful to somebody. And if it was, and you think someone else in your life could benefit, please pass it along and share it. Share the knowledge. Thank you both so much for being here.
You're welcome. Thank you, Lisa.
Thank you so much for joining me today on VisibilOT. If you found this episode helpful, please share it with someone who might benefit from these strategies. For more insights and tips, follow me on Instagram at VisibilOT, that's VisibilOT. And don't forget to subscribe to the VisibilOT Podcast to stay connected. Please consider taking the time to leave a review or rating on whatever platform you're listening on. And until next time, take care and stay visible.